Now we will discuss different surgical procedure for cataract. As previously I told you in congenital cataract and in senile cataract that the definitive treatment is only surgical removal of cataraceous lens. So before going to this surgical procedure, you should keep in mind that lens can be removed in two ways. The first one is the extracapsular cataract extraction, ECCE, okay, and the second is the intracapsular cataract extraction, ICCE. Extracapsular cataract extraction, it is the removal of only cataraceous lens, okay. We only remove the cataraceous lens and we keep the capsular bag intact. We do not remove the capsule, okay. The capsular bag is kept intact and the cataraceous lens is removed. This is extracapsular cataract extraction. And then we have intracapsular cataract extraction, in which we are removing the entire lens, okay, with the capsular bag. This is extra. Now this procedure is not applicable anymore as it carries a lot of complications. So we will only discuss extracapsular cataract extraction, okay. This removal can be done through a lot of procedures, and the common procedure will be discussed now, okay. So this is the capsule, right? The first one is phacoemulsification. What is phacoemulsification? Now we will discuss this procedure step by step. Remember, two steps are common in all these procedures. The first one is that we will wash the conjunctival sac and the surrounding skin with povidone iodine antiseptic. And the second is that pupil should be fully dilated in all individuals, okay. So these are common. Now what are we doing in phacoemulsification? In phacoemulsification, first of all, we will make a nasal incision or temporal incision, okay, on the nasal side or temporal side. This incision we will make it with keratotome, okay. We will make an incision through the cornea with keratotome, okay. With keratotome we will make an incision. Now this will be followed by the injection of viscoelastic substance, for example hydroxy polymethylcellulose, okay. This viscoelastic substance will be injected in order to keep the fluid balance, okay. Now we will make a second incision. The second incision we will make it at right angle to the first one, okay. We will make it at right angle, okay. The purpose is to balance the hydrodynamics and for instrumentations, okay. So after viscoelastic we are now making a second incision, okay, into the cornea for the hydrodynamics and the fluid balance, okay. Now what are we doing? The fourth step is that we will remove this interior capsular pole, okay. This is called interior capsulotomy or interior capsulorhexis. This interior capsular pole is removed through cystotome, okay. With cystotome we will remove this interior capsular pole, okay. This is capsulorhexis. Now we will do hydrodissection and hydrodelineation. What is hydrodissection? We will inject the water, okay, and we will separate this capsule from the lens fibers. The separation of capsule from the lens fibers, this is called with water. This is called hydrodissection, okay. We will do hydrodissection. Now we will separate this nucleus from the surrounding fibers, okay. The surrounding fibers are soft as compared to the nucleus, so we will separate it. And this separation of the nucleus from these surrounding fibers, this is called hydrodelineation with water, okay. After hydrodissection and hydrodelineation, what will we do? As this is the lens, I have taken the lens nucleus outside, okay. So what will we do? We will move this nucleus in this capsular bag, okay. We will move it In order to make it movable, we will move it. And now we will make a groove with ultrasound with the PHACO. This is the PHACO probe, okay? This is the PHACO probe. So with the help of PHACO probe and ultrasound, we will make a groove in this lens. Okay? Now a groove is made. Now we will rotate the nucleus and we will make this nucleus is rotated, and now a second groove will be formed. Okay? We will form a second groove. Now we have divided the lens nucleus into 4 quadrants. And now with the help of chopper, okay, with the PHACO probe, if this is the PHACO probe, okay, if this is the PHACO probe, and this will be the chopper. So with the help of chopper, we are breaking this lens into 4 quadrants. As first of all, we group the nucleus with the help of ultrasound vibrations, and now we will break with the help of chopper. We will break it into 4 parts. Now with the help of ultrasound and chopper, we will further break the lens into smaller pieces, and ultimately we will these small pieces. Now we have made a lot of small pieces of nucleus. Okay, there are a lot of small pieces, as this can be seen. We will aspirate these. We will aspirate with aspiration irrigation cannula. We will aspirate these small pieces, and we will clear out this cataraceous lens. Okay, we will clear out, and we will only keep the capsular bag intact, as it is extracapsular cataract extraction. Now we have removed the lens parts, okay, and the debris. What will we do? We will place an intraocular artificial lens, okay? As in most of the cases, intraocular lens is placed during operation. So we will through delivery system, we will inject an intraocular artificial lens, okay? And lastly, we will apply pad and bandages on the eye, okay? And there is no need of suturing, as these corneal incisions, these are very small, so they do not require suturing, okay? So these were the steps of phacoemulsification. Now, this femtosecond laser cataract extraction, remember all the steps as we did in phacoemulsification, they are similar in femtosecond laser cataract extraction, but all these steps, they are now with NAD and YAG laser, okay? We are making these incisions, this capsulotomy, the removal of interior capsular pole, and this breaking of lens into pieces. All these processes are now with the NAD and YAG laser, okay? With the NAD and YAG laser. This is very short, this is very ultra short pulse laser, okay? And now this is a recent procedure, okay, which is approved by the FDA. So remember, all the steps are similar, only we are doing these all steps with laser. And what is the advantages? The advantages of FSL over the phacoemulsification is that these incision will be very accurate, okay? This corneal incision, the capsular bag incision in terms of its circularity, okay, in terms of its margin. So the incision and the breaking of lens, this will be very accurate, and it will also reduce the instrumentation, as at last we will aspirate these debris, okay? So there will be no need of chopper and further instrumentations. So that's why the advantages are that it will reduce instrumentations and hence post-operative complications, okay? Now, the third one is the surgical procedure is the small incision cataract extraction. In this procedure, all the processes are manual, okay? These incisions, but remember, there is no corneal incision in the small incision cataract extraction surgery. We are making a corneal tunnel, okay? We are making a tunnel which is sclerocorneal tunnel, okay? We are making a tunnel, sclerocorneal tunnel is made For example, this is the sclera, okay, and this is the cornea. So we will make a sclerocorneal tunnel. And all these procedures, the capsulotomy, this breaking of lens into pieces, this is done manually, okay. We are through sclerocorneal tunnel, all the procedure which we did in FHACO and Femto, this is done now manually. This procedure is not applicable as the phacoemulsification and FSL, they are expensive. So this small incision cataract extraction is an alternate to these procedures, okay. And now the last one is the conventional extracapsular cataract extraction. All the steps as in PHACO, Femto and small incision, they are similar, okay, with the few differences. What are they? These differences are, first of all, we will make a partial thickness incision. A partial thickness incision will be made in the cornea, okay, and is followed by the viscoelastic substance hydroxypolymethylcellulose. And now this partial thickness incision, it will be converted into full thickness corneal incision through the corneal scissor, okay. So after this formation of a large and full thickness corneal incision, we will remove this lens, okay. This is the large incision. We will remove this lens by expression method. The entire lens will be removed, okay, the entire lens. The entire lens nucleus will be removed without breaking it. We will apply a pressure on the 12 o'clock and 6 o'clock position, and we will deliver the entire lens nucleus, okay. And after that, any debris, when there is any debris left, that will be aspirated, and with aspiration, okay, with aspiration irrigation cannula, we will aspirate the remaining debris. So these are the steps in conventional extracapsular cataract extraction. But remember, as the suture is, it is a full thickness corneal incision which is made with corneal scissor. It requires suturing, okay. So we have to suture this. We have to suture this incision, okay. We have to suture it. And after suturing, we will apply pad and bandage, okay, on the eye. So these were few of the differences in conventional extracapsular cataract extraction. So these are the surgical procedure for cataract removal. Now, before ending this lecture, you should also know different types of lens, okay. So we have mainly two types of lenses. We have interior chamber lenses and we have posterior chamber lenses. Interior chamber lenses, they are placed in the interior chamber, okay. We are not placing the lens in the posterior chamber. And this is because this is intracapsular cataract extraction, as we have removed the entire lens with its capsular bag. So there is no capsular bag. So there will be no support for the lens. So that's why we are keeping this lens in the interior chamber. And we have the posterior chamber, and which this is done in the extracapsular cataract extraction, and which there is a bag, capsular bag, okay. In this capsular bag, we are keeping the intraocular lens. Now, the lenses can be ridged lenses and flexible lenses. Ridged lenses means that these lenses are ridged, and they require an incision which is equal to their diameters, okay. So it's a ridged lens and it cannot be flex or foldable. So that's why we will make the diameter equal, we will make an incision equal to their diameters. These are called ridged lenses, okay. In the ridged lenses, for example, it is made up of mostly polymethyl methacrylate, PMMA, polymethyl methacrylate, okay. And we have the flexible lenses which are commonly used, okay. The flexible lenses can in turn be foldable and rollable. Foldable lens means that we are folding the lens and we are injecting into the cornea, okay, into posterior chamber or interior chamber through a delivery system. and this require an incision up to about, as the ridge lens require up to about 5 millimeter incision, okay, and this foldable lens require up to about 2.5 millimeter incision in the cornea. So the small incision is required for the foldable lens, and even for the rollable lens, they are so ultra short, ultra thin that it can be injected even by 1 millimeter incision, okay. If there is only 1 millimeter incision through the cornea, we can inject these ultra thin rollable lenses, okay. So flexible lenses can be foldable and rollable. These flexible lenses are made up of several substances. For example, these lenses can be acrylic intraocular lens, silicone intraocular lenses. We have hydrogen intraocular lenses, and we can also made it from collagen, okay, which is polyhydroxymethyl methacrylate, as the ridge lenses are made from the polymethyl methacrylate. But the polymer which is the collagen, it is made from polyhydroxymethyl methacrylate, okay. So these all lenses, they are flexible lenses, and in turn they can be foldable and even rollable, okay. This was about the surgeries and types of lens, okay. I also have prepared notes. I will give you the link in the description. You can also go through the notes and can learn more. Thanks for watching the video.